Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
Did you see the sunrise again?
I didn't.
It's almost as pretty as your shirt and your tie.
Oh, really? I got a sunrise shirt.
That's right. That's what we should call it, the sunrise shirt. Okay, and so you, as normal.
So congratulations
thank
on the
you.
Cure Symposium.
Yes,
It was so nice.
Well, and I have to congratulate your staff because there's not a time when your staff, including Dr. Rosemary, but Dr. Arias, who
Dr.
people
Arias.
have heard him on the show before, but he absolutely was, he was like a movie star. And what he did there to show people what a smile trial really was
As a
amazing.
prosthodontist, he's an amazing.
But he's not just a prosthodontist. No.
No,
I've met
he's a great person.
prosthodontists. No. He is the prosthodontist.
Yes.
No, I mean, really, he's so well educated and he went to the extra. He's talked about it here. But
And
to
then what
see
about
him in
Nicole?
action, and what he did, people were coming up, and I know that there were two people right away said, I want to do that. I'm coming in.
Yeah.
And it was really
even
beautiful.
the plastic surgeon was very impressed.
Listen, Dr. Mann came up and he insisted on seeing her. I have pictures of him with her, Doreen, because you see, and I was saying that here you have a plastic surgeon that does all the right things for the face, but then they open their mouth and yikes.
Yes.
But he can't do that. He
Yes.
does a lot of things, but he's not a prosthodontist.
I
I
will-
think he wants to work with him.
I'm going to show you the picture of it before and after because, I do aesthetic. So I have a lady that came in and I did a chemical peeling to get a lot of the wrinkle off the face. And it's like, with chemicals, so we go really deep. And after the heal, it's like a facelift. And even when I took the before picture, and right after the chemical peel, your face is all blue. I took another picture, and I kept looking at her teeth. And I say, sweetie, before you leave this office, you have to see the dentist. We have to fix your teeth. Because, she's widow. There's a guy that likes her where she lives, and she's thinking about start dating. And I said, let's fix your teeth too. So she's fixing her teeth now. It's amazing. What I saw her yesterday. She came in for her preliminary bridge that they're doing on her for the front. It's going to look great. I'll show you the before and after.
Okay, why is it, Dr. Mencia, that people see the outside, but they don't realize that their teeth, they are so important?
That's a great question. That's why I brought my guest today.
Okay, why don't you introduce who
Yes.
your periodontist is?
The beautiful Dr. Nina Cunningham is a periodontist, and she studied Nova University.
Correct.
And I have the pleasure of, first of all, we are neighbors, so we see each other all the time. And
That's right, in the elevator.
Yes, in the elevator going down,
yeah.
and her husband Josh were always talking. And
Does she know your dog?
of course, they all know my dog. Everybody know my dog.
Well, I think we ought to go back and tell people what actually is a prosthodontist.
A
I'm sorry,
periodontist.
excuse me.
That's
Yeah,
okay.
I got this
It's,
prosthodontist. Periodontist. Maybe we should let Nina tell what a
Nina.
periodontist.
Well, Nina, first of all, good morning.
Good
Good
morning.
morning. Thank you so much for having me today.
Our pleasure, our pleasure.
Well, periodontist, we basically do everything surrounding the teeth, all the gum tissue, the bone, anything to keep the tissue around the teeth healthy. And so and also aesthetic things. It's called periodontoplastic surgery. So we do these procedures, implants, anything in that regard.
I'll tell you a funny thing now about this. I'm just going to say this. I believe that it's hereditary because in my family, my mother and her sisters all had periodontal problems.
Absolutely,
And so that was something that I inherited.
Yeah.
And so I have been extremely careful about having my gums, everything taken care of. And if you're really careful, you can retain your good gums. And I hope
Absolutely.
that that's
Yes,
what you
yes,
tell people.
and
They
that's
don't
it.
have to have that very painful periodontal work if they just do it on a daily basis.
You're right. And that's a good point you bring up. It runs in the family, and that's something we would ask the patients, what do your parents have? Did they lose their teeth at an early age? And yes, it's treatable, periodontal disease, but obviously if you want to do preventive care, that's the key. Yes.
You know, Dr. Mencia, your wonderful staff introduced me. It sounds crazy because for so many years, you know, I've been so careful with my teeth, but they told me about the electric toothbrush.
Yes.
And I bought it, thank goodness, from your organization. They told me what to buy. And it has a gum, you know, on it for your gums. My teeth have never been better since I've been using that electric toothbrush. And now also the, what's the other thing that you use with the water? The water pick.
The water ping.
Yeah.
And so, I mean, it takes about, 3-4 minutes in the morning. But what a saving grace that is.
Yes. Yes. But the thing is, as an internist, since we have to deal with the entire body, we don't connect the mouth with the rest of the body, unfortunately. And you have no idea how many times I see patients that come in with exacerbation of asthma. And they say, oh, my asthma was fine. I thought I have outgrown my asthma. And suddenly I'm start getting asthma attack. And, a good internist have to do a full physical. And that's why I think Nina and I going to work great together, because it's one of the subspecialty in dentistry that they have to deal with the human body.
And yes, everything's related. That's absolutely correct. The mouth connects everything to the rest of the body. So anything that goes on in the mouth will affect the rest. So other diseases would be diabetes, cardiovascular disease, everything that
even cancer.
Even cancer has been shown.
Has been shown. There's a study that showed that I think it was around 49 to 54% of men that develop pancreatic cancer have periodontal disease, have gum disease. So cancer have shown that there is a percentage of men and women that develop blood cancer that had been associated with periodontal disease. So taking care of your gum is not only because you're going to lose your teeth, that's going to happen, it's the consequences. Nina, why don't we talk a little bit about the association between gum disease and the heart?
Yeah, that's correct. The heart diseases has been shown that, for example, if you have bacteria build up in your body, it gets into the bloodstream. Bleeding gums, the bacteria get into your bloodstream, and it can cause an inflammatory
responses.
Yes.
Sure.
Correct.
It's true. And periodontal work is, you don't hear that about people. They don't say, I went to my periodontist, and people, when your gums are bleeding, let's talk about gums bleeding. Is that when you brush your teeth? When do people see their gums bleeding?
Yes, they usually see that when they brush, they floss, and that's a sign that you have an inflammatory process going on, and that you need to see somebody to take care of that. You might need a deep cleaning, get that all the inflammatory response taken care of, reduced, and then that will stop. And so that's what we work at.
And that's a good point, because a lot of people, it doesn't just start all of a sudden one morning, you have bleeding gums.
Yes.
Doesn't it kind of, it kind of goes, a little bit at a time, and then your gums start to recede. So this is, that's why, how often do you think someone should come to a dentist and have their mouth checked? Because they are checking the gums.
At least once a year for an annual periodontal evaluation. That should be part of the protocol. And
especially those diabetic patients. Patient
Correct.
with heart disease, patient with lung disease.
Yes. And when you have periodontal disease, it's a chronic disease. So once you have it, you will have it for the rest of your life. So you will have to take care of your gums and have the right mindset that you have to come in for cleanings at least every 3 to 4 months in order to prevent it from progressing.
It's funny, Dr. Mencia, about eating. So what kind of food... when someone has periodontal disease, are they not eating properly also? I mean, is there maybe they're eating too much candy, too much junk, and it's got to be
absolutely.
affecting their
Yeah.
teeth and their gums.
And that's why usually, and that's one of the beauty of our practice is having two dietitians working with us. Then we work with the dietitian so that the dietitian and the periodontist can now look at the patient and say, okay, let's work as a team. And the food that you are eating that is worsening your gum condition, let's start moving things around so that whatever treatment we're doing for the patient, it will be much more effective.
You know, Dr. Mencia, the Cure Symposium was very successful, but you had the shining stars. Besides Dr. Arias talking about, Nicole Andrews is a brilliant young woman, absolutely brilliant. She went on and started talking about certain things, and of course she was matched with the woman, the research scientist from Scripps Research, who
I heard.
Oh,
yes.
So the two of them was a panel, and they were both fantastic. So, I mean, here you bring this, lovely Nina Cunningham, and somehow you just have a knack for bringing such great people to your practice. I mean, forget that they're good looking. That's something else. But even if we put a bag on their heads, I know, but
a lot of my patients, they say, doctor, where you get all these people? Everybody is so handsome and beautiful.
And
where
that's
you
right,
get them?
men and women.
I say, it's like I met Nina in Las Vegas. I say, what are you doing here? I'm a dancer. Why don't you come and become a periodontist with me?
So bad. But really, it is interesting that you are very careful about the people whom you choose. I know at least you bring them here. They don't know this. This is a test.
That's
the
right.
first thing they do is bring them here. If they don't pass the test, that's it, right? But they're articulate, they're knowledgeable, and they're very
smart.
caring. Well, and caring.
Nina is smart. Nina is fluent in German.
Well, that
so
does it, right?
I get to practice my German with her a little bit.
You have to practice your German. But they're very, very, very kind, which we know is they must be when they work for you. You know that.
Mm-hmm.
They have to be nice, and they have to really care about their patients.
Yeah, well, it's part of the philosophy of the practice. It's a good bedside manner. When people come in, they are scared, they are concerned. And the last thing they want is a dentist in a big horse that won't even look at the patient. So, it's very important. It's like Nina was saying.
It's a fun part of the profession, caring about your patients and being with them and making them feel better.
And I see you guys at work sometime, and you guys are talking about how are your kids, how's the dog, how is this. And I say, wow, it's so beautiful. It's like more than just the teeth. It's like you as a person. They get to know you as a person and what you do. Because, you have people out there that they are lawyers and they have to be in court all the time. So their smile is important. You lose a tooth and you are a lawyer and you're talking to a client and they look at you with a missing tooth. It's automatically the image changes.
Yes, it's amazing,
you can be a mechanic, you can be a painter. They look at you and that image automatically changes on the person receiving the conversation.
Okay, so Nina, this is going to be the make or break question.
Oh my goodness.
My dog is here, and we rescued Snowy, and she came to us with not very good teeth. I don't know why. No one ever took care of her teeth. And so the back molars are okay, but the little front teeth, they want to clean them, but they're afraid some of them are going to come out. Mm-hmm. And I've just been keeping from doing that. Oh, what can I do? I hate to think that. Why do I have to have her?
I have a lot of dogs, and I tell you, small dogs, they are very prone. My Chihuahua is only 8 years old, and all the front teeth are out. They tend to lose their teeth very young.
So I should allow that to happen? Why?
Yes, but if you don't have them clean it, then it will just get worse.
It's like human. It's like human.
Yes.
It's like human. I mean, if we think, we are all creation of God. So we all have, basically, the dog have the same gum and bones. And,
we don't have anything magic, right? No magic?
No, it's that we don't tend to, we don't tend to.
You passed.
She's honest, right? She's honest.
Okay.
Dogs and people, as we start aging ourselves, human. You don't depend on somebody else to take you to the dentist. But dogs and, elderly, we just neglect them. We say, you're in your 70s, your 80s, your 90s, so you don't have to take care of your teeth anymore. And, I usually say in geriatric medicine, health starts with your mastication, with your mouth. If you are not able to eat properly, if you are not able to chew, you are not able to smile, it's going to affect your health and it's going to affect your psyche. Well, a person that my grandfather died at 109.
Did he have his
He
teeth?
he had his teeth. He didn't have denture. So I think people, if they take good care of themselves, regardless of, they start young. That's why I'm so happy Nina is here and working with us, because gum disease starts at a very young age.
Yeah, but what? Well, go back to the dog. Well, what that? Because
Here
it's
we go with the dog.
Well,
Sorry,
if you
sir.
took a person in there and took all their front teeth out and didn't do it again, can't get replacements for her teeth. So,
Yeah,
what's
it's
she
gonna
going
be
to feel
hard.
like when she wakes up with no teeth in the mouth? I'm really serious. I'm glad you're on the show today because I've been very concerned about this. But do you think it'll
again-
change her personality?
No, the dog.
so.
No, the dog won't change their
don't think
personality.
so.
Human, yes, but not dog. No.
But if they take the teeth out, they take it out because there's an infection going on.
Right.
So you're helping her health.
Exactly, because that infection can then go to their heart and affect
Anywhere
their heart.
else, and that's what we're talking
Yeah.
about, right?
But isn't it like you just put me on vitamin D and what can I get? She is on dog vitamins, wonderful vitamins. But
Good.
is there anything I can do? I mean, anyway, I know.
Maybe get some mouthwash.
Well,
Let's
I
talk
don't know.
about mouthwash.
Oh, what?
You know,
That's a
I'm
good-
having.
that's good.
Tell you, I mean, there's a lot of
You believe in
junk
that?
stuff. I think there's a lot of junk mouthwash out
Yes.
there. There's a lot of junk stuff out there, and people don't know. People go sometimes, oh, this is something special, and might as well just buy water.
And the only time we prescribe or recommend mouthwash is after we do surgery, because that's when you cannot brush an area, and so we prescribe, usually give Peridex or chlorhexidine in order to prevent the infection in the area for the next 2 weeks. And other than that, we don't usually.
Right.
I don't like. It's
Recommend
like I
them.
don't really like mouthwash. I don't ever use mouthwash.
No,
don't
neither
either.
do I. I don't.
And why do you think people like it? Bill happens to like it. He has great teeth, but he happens to like it. I don't like it, but
I guess it's a refreshing
Is that what it
feeling,
is?
the taste,
Right.
that moment when you're running.
But it's a temporary refreshment.
Yeah.
Yes.
Because in reality, if you have bad odor and you use the mouthwash, for the moment you feel the
yeah.
mint or the flavor from the mouthwash, but 5 seconds later, a minute later, then it's gone.
right.
The other thing is, and that's not perio, but for cavities, when they have fluoride in it, then they prescribe that more.
Okay,
But,
the next
yeah.
topic then is gum.
Okay.
Tell me how you feel about people chewing gum.
Um,
I don't
chewing
mean
gum.
whether you like it or not, but I mean, what is it for their? I would think it's not very healthy for their teeth,
It's
but maybe I'm
long-
wrong. I have no
as
idea.
long as it doesn't have sugar, it's fine.
Doesn't all gum have sugar? Oh, you mean sugarless?
No,
sugarless.
sugar. No
Yeah.
sugar in the gum. There's called xylitol, which is actually good. That's been shown that it goes against cavities, goes against caries, and that helps with it. But as long as it doesn't have any sugar, it's sugar free, then that's okay.
Of course.
I had to put it in my
Right,
product line.
Of course, you ever see people talking to you when they're chewing gum, and I mean, it's pretty.
Yeah, that's
you know.
a different thing.
Yeah, I
That's-
know
Yeah.
this,
I
but
don't
there
like
are
it.
people who chew gum all the time, and I was just
Yeah.
curious if that's good for their teeth. So most of them, it's not sugarless. Most of them, I think, are just
Yeah, and then
and so that
affects it.
adds like sugar all the time to their teeth,
sugar,
right?
and then you can get cavities. Correct. Yes.
And should people be rinsing their mouth after they eat I mean, if you're out, I've seen people in restaurant ladies' rooms, they're brushing their teeth and I don't do that, but I mean, I don't know
Yeah.
about that.
Usually, we just recommend to do it twice a
Right.
day, and that's
It
fine.
works,
that's
right?
enough.
I guess
Yeah.
people just don't want to go back on the table with food between their teeth.
Yes.
You have beautiful teeth. Did your parents? Did you have braces?
I didn't have braces,
They're
but both
gorgeous.
my parents are dentists. My brother is a dentist. My uncles are
I was
dentists.
like, you
My
sat in a
cousin is
lot
a
of
dentist. So
dental
yes.
chairs, but your teeth are beautiful.
Thank you.
But that's all natural.
That's all natural.
I thought maybe they went to your center. She went to your center and you took her, did everything.
Yeah. Yeah, well, I mean,
They'll
that's
say,
one
I
of,
want teeth like you. I do, right?
a lot of the patients, they look at me and say, "Oh, Dr. Mencia, I love your smile." I say, "Go to my dental department."
Yeah, right. No, well, we know having great teeth, but I was just curious. I mean, so if someone comes, this is a question then. So if someone comes and they're any other kind of in other fields that you have, but their teeth aren't very good, I bet you wouldn't hire them.
Well, you're putting me on the spot. I don't know.
that's
Or
a
maybe
cookie
you'd say, okay, but there's something you have to do. You have to do. So let me just give everybody the way that you're going to get to meet, of course, Nina, and also see Dr. Mencia. He's open on Saturdays. That's where he rushes off to.
And Nina will be able to see patients on Saturdays, too.
Oh, okay. All right. So the phone number in Fort Lauderdale is 954-489-1345. 954-489-1345. And that's the one in Fort Lauderdale. And if you want to go to their Boynton Beach office, this is great. No, a year ago, I couldn't even say this. Now you have the Boynton Beach office. You have the Fort Lauderdale office. The Boynton Beach office is 561-270-6494. The home visit services are available. They're very important. Don't really be fooled by thinking you're just going to stay at home and everything's going to get worse and no one's going to come and see you. Aha, Superman comes and comes through the window into your house. No kidding, but it is a wonderful thing to have happen. And so we want to make sure you know that. And of course, Medicare and most major insurances are accepted. And their website is AGI for Adult Geriatric Institute FL.com. So it's AGIFL.com. And again, I do want to thank you so much, Dr. Mencia, for allowing two of your most important staff members, professionals, to come to the Cure Symposium.
It was my pleasure.
Yeah, it was great seeing
they were
them
very
doing
happy
that.
to be there. When they see Dr. Cunningham for gum disease, the beauty is we also have the hygienists that work there that will follow through with a regular visit between visit with Dr. Cunningham. And some people say, wow, that sounds like very expensive. A lot of time, if you have dental insurance, your hygienist is covered 100%. You pay nothing. It's a free visit.
And they should come in twice a year. Can they come in twice, or what does it pay for? Once?
It depends. I try to push my diabetic patients to come at least 4 times a year, at least.
Good.
For the eye doctor as well, and for the podiatrist, because it's all about prevention.
Yeah.
We want to keep you healthy.
Well, and so when those people, these people are having serious problems, and so where does it affect first? Their gums? What if someone's diabetic? What do you look for? We know that.
That's a great question. That's a very good question. Lots of time we are suffering with a condition that we don't even know we have it. So you can be what people that tend to go to the doctor frequently, and we discover that they are in the verge of developing diabetes, and we call them pre-diabetic. So those people are great to work with if you are like me, that you like to practice preventive medicine, because then we aggressively see the dietitian and frequently, and we start modifying your lifestyle. And by modifying the lifestyle, a lot of time we are now helping the pancreas work with what you have. Instead of keep pushing the pancreas. It's like a stress test for the pancreas. Like we do stress tests for the heart. As you eat a lot of starches and sweets and fruits, it will increase your sugar to a level that your pancreas cannot handle that anymore. The same thing with the hypertension. The blood pressure start rising. We call that the silent killer, because you have no idea your blood pressure is going up.
And same with gum disease. You don't feel it.
And
it doesn't hurt.
Gum disease, you look at your mouth. If a lay person look at your mouth, and you don't know how deep your pockets are. If you have any problem in there, your mouth looks okay. But when you go to the specialist like Dr. Cunningham, they do a good history and physical. She's a specialist, so she'll do a good history and physical, just like I do. That's what we share in common. And then she start working with you, and then she'll tell you what stage of gum disease you are at.
Exactly.
And then they start working with you to help you come out of that stage into a better position.
And the nice thing is you can recover. You know, it's not like cancer. You can recover
Yes,
if you just
it's
take care of it. So,
Right.
Dr. Nina Cunningham, thank you so much for
Thank
being here
you
this
so much
morning.
for having me.
And Dr. Mencia, let's just give your number again. He's rushing off to go to the office.
We got
to go
patience.
to the clinic. 954-489-1345. Don't delay. Just go do it. Go see Dr. Mencia. If you can't get there and you need a home visit, call that number and ask for a home visit. And so, Dr. Mencia, we did it again. And
Yes.
you keep rising the bar here.
Absolutely.
I don't know what we're going to do next, but we thank
But
you again.
we have to do Dr. Cunningham and Dr. Arias. That would be a nice team.
Oh,
Yeah,
yes.
well, I
Yeah.
think it's
I'm
that's
looking
great.
forward to that.
Yeah, great.
The prosthodontist and the periodontist.
That's right. You really, I mean, this is amazing. You started out, it was Dr. Rosemary when I first met you 5 years ago or 7 now. We've known each other a long time now. But it was Dr. Rosemary and maybe an assistant. And now all of a
Right.
sudden you've got a team there.
team,
It's just
absolutely.
wonderful. So thank you very much.
Thank you.
You're welcome.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.